Hey everyone, welcome back to another episode of Expanding Access, recorded live here at Behavioral Health Tech. I'm so excited to be welcoming Wes Williams. He is the Chief Information Officer at WellPower. Wes, thanks for joining us.
Thanks for having me. I'm really glad to be here. Let's see. So I'm at WellPower. We are Denver's community mental health center. We provide health equity-oriented safety net services for the Denver population, right? We have sort of lifespan clinical services, outpatient psychiatry and psychotherapy, but also a large sort of focus on health-related social needs, right? So we have something like 130 residential treatment beds, a similar number of permanent supported housing beds, a number of crisis locations that work 24/7, and then lots of providers out in the community, both doing intensive case management as well as school-based services and other embedded programs, along with a pretty extensive criminal justice partnership.
I love it. You guys are very ingrained in the community, serving in a lot of ways. For you, what sticks out as the best way to expand access to care in the community?
Sure. Well, I think meeting community needs is the most important, and sort of listening to what those are and taking a really individualized approach to sort of health equity, right? Like, where are there gaps and how might a provider like WellPower fill those, right? And so a lot of that is actually out of the purview of someone like me as CIO, thinking about how, where we want to put a new location, maybe in the community, or how, what a new program might sort of bridge gaps in access to care. But I do think technology can enable a lot of that, right? Helping us think about providing the right service at the right time.
I love that. Yeah, and it's great to hear your perspective on that, as a technologist to see that there's opportunities to bridge gaps, really maybe without technology, but tech is a big part. And here at the conference, there's a lot of technology companies seeking to solve problems. What have you guys been looking at lately? And the topic of AI is also a big one. So from AI and tech, what sticks out to you as the biggest opportunity to solve the biggest challenges you guys are faced with?
Yeah, thanks. I think, a lot of what AI promises is sort of like smoothing out efficiencies or unnecessary waste in the system, right? And really helping combine and condense a lot of vast amounts of information that folks don't have, right? Like, my team and I, we spend a lot of time poking around in the data, but an individual clinician or medical provider doesn't really have the time to do that, right? And so, I think one of the things I'm most interested in right now is sort of an extension of the digital scribe that we've seen a lot of traction with, where it's sort of retrospectively looking at someone's sort of entire chart and what's the right summary of care at the right time, right? And how does that look different for example, a psychiatrist versus a crisis worker versus a pharmacist versus a case manager focused on health-related social needs.
I love that. Yeah, and taking a look at that, using technology to really help you scale observation and find trends.
That's right. Yeah.
Deliver on that.
Exactly, and find trends at the individual level, right? How we can leverage tech and AI to make care even more person-centered.
I love that. That's really great. As you think about what's next, as you leave this conference, really, what call to action would you leave to our listeners and viewers, Wes, and ways they could connect with you, partner with you, or take access to care to the next level?
Yeah. Wow, tough question to end on there. But I think, we are always looking for novel solutions, but we're not looking for solutions like a hammer going around looking for nails to whack down, right? So I think I'm a huge believer in human-centered design and sort of deeply understanding problems and then providing a level of sort of matchmaking. And at some level, that's what I'm doing here at this conference, right? Is to sort of understand the sort of array of different hammers and screwdrivers and drills and other tools available so that later I can match them to the problems that I'm finding and that we're trying to address at WellPower, right? So for folks listening in who, maybe are thinking like, I'd love to partner with Wes and WellPower, I think it's a matter of like letting me and us know sort of what you're doing and what problems you think you're really good at solving, right? And we'll go from there.
I love it. I think that's a great way to summarize it, Wes. And if people want to learn more about your organization or reach out, where's the best place they could do that?
Yeah, we're at wellpower.org. So just find us there, and I'd be happy to chat.
Outstanding. There you have it, ladies and gentlemen. Wes Williams, Chief Information Officer at WellPower, here from the Behavioral Health Tech Conference on the Expanding Access podcast. Check out the show notes for the summary of today's discussion, as well as the website where you could learn more about WellPower and Wes. Thank you all for tuning in. And Wes, thanks for being with us.
Thank you very much.